Okay, well, welcome everyone, and welcome to the weekly graduate seminar series at the Dahdaleh Institute of Global Health Research. My name is James Orbinsky, and I'm the director here at the Dahdaleh Institute for Global Health Research. And I'm delighted today to host the Dahdaleh visiting scholar, Professor Srinivasa Srigiri. It's not bad, eh?
Yeah, it's good.
Okay. Who will lead today's seminar. And he's titled the seminar, Analyzing Environmental Integration in Antimicrobial Drug Resistance Strategies in Kenya. Now, before we actually begin with the seminar, as is our usual practice, I'd like to begin with our Indigenous land acknowledgement. And this is a hybrid event. There may be nobody online now, but there may be. So some guests may be on different territories, but please take the time now to give thanks and respect to the land on which you are currently living on and working on. And today we're here physically at York University campus here in Toronto. And York University is situated on the traditional territorial area known as Dahdaleh. And we acknowledge its current treaty holders, which are the Mississaugas of the Credit First Nation. And we also acknowledge that this is the traditional territory of many Indigenous nations, which include the Anishinaabe Nation, the Haudenosaunee Confederacy, Huron-Wendat, and of course the Métis. And this territory is subject to the Dish with One Spoon Wampum Belt Covenant. And this is an agreement among peoples, Indigenous peoples, and others, to peaceably share and care for the Great Lakes region that we are in. And with that acknowledgement, let me just briefly introduce Srinivasa.
Srini is just fine, yeah.
Srini, okay, or Srinivasa. Srini has his PhD in agricultural economics from Humboldt University in Berlin. And his primary research interests involve governance of natural resources, sustainability transformations in rural and agricultural sectors, and strategies for climate adaptation at national and subnational levels. And he is a visiting scholar here at the Dahdaleh Institute, largely through Professor Adil Boren, who runs a major research initiative here at the Dahdaleh Institute. And Srini is today going to focus on antimicrobial resistance strategies in Kenya and the relationship to environmental integration. And I will also mention that since August of 2019, he holds a position as a senior researcher within the research program on environmental governance at the German Institute of Development and Sustainability, also known by acronym as IDOS. And prior to joining IDOS, he held research positions with the International Crop Research Institute for Semi-Arid Tropics in India, and also at the Institute for Advanced Studies and at the Humboldt University in Berlin, Germany. And very much looking forward to your presentation. It's a 1-hour seminar. It'll end promptly at 3:30, and we'll start with roughly a 20-minute presentation from Srini. And I've forewarned him that we're a very gentle group, so don't be nervous. New ideas are very welcome, and even nascent ideas, so don't worry about that. And then we'll have, after his presentation, we'll have roughly a 30-minute question and answer, a question and discussion period. And with that, I'd just like to invite you, Srini, welcome, and over to you.
Thank you very much, James, for the kind introduction. Yeah, while the slides are loading, they're already here. So, as I mentioned, I do not have a background in health, human health or animal health. So probably I'm not even an ecologist. So the real hard parameters of health in all the three sectors are a bit, unfamiliar to me in such, like in depth. But with that disclaimer, and I should also give another disclaimer that it's an ongoing analysis. It's a recent study. It's part of a project supported by the German Ministry for Economic Cooperation and Development, who is our main supporter of the institute. And the field research was conducted very recently, ended in January, let's say, and then so the analysis is ongoing. But I dare myself to present the ideas and some of the preliminary findings of this research. Yeah, with that, and then going into the topic of today, analyzing environmental integration in antimicrobial resistance strategies in Kenya. I remember the title was much longer, and Teresa asked me to condense it, but I think it reads well. Yeah, thank you. It conveys the message. Yeah, please. Thank you very much. Yeah. Okay, it's with me. Yeah. So I roughly structured my talk today as follows. I'll just give a brief background about antimicrobial resistance and the governance aspects of it. I think I was told, because it's an interdisciplinary audience, I also introduced, I had a small introduction of AMR itself and why environmental dimension and so on. And then followed by research questions that the study pursues and methods, and then going into the case study in Kenya, what are the existing antimicrobial resistance mitigation strategies, and what is our conceptual and analytical approach with what we enter into the study, but ending with some preliminary findings as well as some preliminary conclusions again, and next steps that are to be followed. So just to give you a brief introduction, I'm sure many of you are familiar with antimicrobial resistance, but still, this is microorganisms like bacteria, virus, fungus, and so on, and protozoa. They develop antimicrobial resistance through genetic changes, mutations, that make them insensitive to antimicrobial substances, the drugs that we use. So as a result, infections can thus no longer be treated, as is the case in right now, which is increasing, that no longer be treated by the frontline established drugs. And this could arise out of many reasons: improper and non-prudent use of antimicrobials in humans, in animals, as well as in crops, in agronomic crops, as well as lack of regulation of access to antibiotics. In many countries, you see that prescription is not required. In my home country, and as in many other countries, you just prescribed. My mother prescribes antibiotics, and then I go and get them. That's what was the case. And also quality deficiencies of drugs, which are available. There are a lot of spurious drugs. If you look at newspapers, it all points to the regulatory lacuna, you can say. And also there are lack of diagnostic and monitoring systems of how resistance is developing and so on, across in different domains, let's say animal health, human health, or environment. And also contamination of wastewater through antimicrobial substances. It could be from the waste, at least I was told that 90% of the antibiotics which we take are going out as waste through the excreta, human excreta. So they go into the sanitation system and wastewater, and they enter into the environmental domain. And yeah, they act as selective agents for the microbes which are present in the environmental domain, which then develop antimicrobial resistance. So what is happening as a consequence of this? A major study, a global worldwide study in 2019, in 2022, identified that there are as many as 4.95 million deaths which are associated, and 1.27 million which are attributed to just antimicrobial resistant bacteria, not other organisms. So that's just in 1 year, in 2019. And what it translates to also is 82.35 million, days which are lost in terms of labor, delis as they're called. And then, if a World Bank study estimated GDP losses by 2050 to a tune of 1.1% to 3.8% by the year 2050. And which is even more in the low and middle income countries, which is up to 5%, which is huge. So this is just to give you, put things in perspective, what antimicrobial resistance, why it is important and so on. So what has been going on to combat this? So this slide gives you a picture what has been going on, starting at the global level. It's been a decade since the WHO formulated global action plan has been formulated and then in action, and has been adopted and adapted in various countries. In 2017, there was as many as 50 national action plans which have been developed, 23 of them approved, and 6 funding sources identified. They were quick to follow in that sense. But of course, if we talk about environmental integration, there was limited as good as no mention of environmental contamination and health in the earlier national action plans. And then we have in 2016 a new tripartite formed together with Food and Agriculture Organization, the World Organization for Animal Health, then it was called OIE, and then WHO, which formed a tripartite. And then they came up with this strategy in 2016, which also has very little mention of environmental dimension and environmental health concerns. No? And then there was an interagency coordinating group of the UN in 2019, which was established, which emphasized a strong focus on environment and waste, meaning to say environment in the water and waste management is really important, and that a One Health approach is really required to address these problems in a very coordinated way. And as a result, UNEP, the United Nations Environmental Program, joins the tripartite to form the quadripartite. Now, at the global level, also the environmental dimension has been a little late to pick up and join the team. And in 2022, what we have in the countries, we see that 62 national action plans have been developed and 30 have been budgeted with operational plan, and 17 plans have been only 17. It's very less compared to what we have, and then 17 national plans have been allocated, have been mapped to national budgets. So if we look at this traces monitoring reporting system, is a self-reporting system that for the global action plan, you see that AMR data for decision making has been used most prominently in the human health planning, the sectors. And if you see, environment is lagging behind. AMR is not even figuring in the mandate. It's not relevant for the. At least they don't consider AMR as important for their planning and sectoral planning. And if you look at this integrated multisectoral surveillance that was part of the global action plan, you see that environmental surveillance is happening in only 26 countries out of the 89 countries, let's say, which have been reported of surveillance. So there's been criticized by some scholars that what is happening is an isomorphic mimicry. Okay, global action plans have been just translated into national action plans, and without any proper harmonization, in functional form, functional harmonization of different sectoral activities. So when it comes to research, it's the dominant themes. If you look at the literature, the dominant themes on AMR have been mostly research and development of new drugs and so on, and also at the most human and animal consumption of human consumption of antimicrobials, not even followed by also the use of antimicrobials in veterinary health sector. And some of the less focused themes as identified by some of the reviews are clean water and sanitation and environmental contamination, and especially even more in the lower middle income countries and less developed countries. And whereas there are also studies which showed that antibiotic residues surpass the so-called predicted no effect concentration values. I think it was a cross-country study of 71 countries in almost all the environmental resources, soil, groundwater, and surface water. So which is a cause of concern. And if you look at the policy practice point of view, the largest funding mechanism, the Joint Programming Initiative on AMR, enlists environment as the least funded of the 6 track categories, which they enlist for funding. And when it comes to review of governance, focus of research on governance, I think there have been very few studies, if at all, and these have also been very technical. basically they follow indicators which are given by the Global Action Plan. So by, say, for example, this comprehensive governance framework, which has been developed for assessing the implementation of national action plans, includes only indicators on environmental dimension, which is like, okay, whether there are experts which were part of the national action plan, or whether there are any regulations and guidelines for disposal of waste and so on, but not really in terms of looking at the effectiveness of these and then surveillance of that, of AMR. Hence, we identified with this identification of the gap. So we contend that, okay, of course, it is also mentioned in the Global Action Plan, and also it has been emphasized in the later strategies, that One Health approach, which emphasizes the interlinkages between human, animal, and environmental health, and achieves and aims to achieve coherence, policy coherence through cross-sectoral coordination, is an important approach to combat or to mitigate antimicrobial resistance in different countries. So with this, we look at, of course, coordination is important, and it's easier said than done. We know how difficult coordination is, and especially not only in the countries with lower income, but also in many other countries in the global north. So with this, we go into research to identify what are the enablers and barriers towards effective governance of interlinkages among sectors relevant for mitigation of AMR development and spread, with a special emphasis on how can we effectively integrate environment, because that has been conspicuously missing in the picture in many countries. So these are other sub-questions which focus on formal institutional arrangements and what are the other factors, socio-economic, institutional, and biophysical factors, which affect the effectiveness of these formal institutional arrangements for mitigating environment-based AMR risk. So, and then finally, looking at what could be the possible options for effective coordination among sectors and to better integrate environment into the AMR architecture in Kenya in this case. So we follow a qualitative case study-based approach, and basically reviewing documents, acts in different sectors, and guidelines, standards, and protocols, and also conducted semi-structured interviews, so far 15, with government and non-government actors in key sectors of agriculture, livestock development, public health, and environment in Kenya, and also the quadripartite focal points, for example, the UNEP and the World Organization for Animal Health and so on, and also actors at the national level who are part of the national coordination committees and county level also, in 2 counties, specifically Nairobi and Kisumu. And data analysis is ongoing. I'm still putting some of the data and based on the variables which based on the analytical approach which I will present away. And I'm using Atlas TI as a software to code the qualitative data of documents and interviews. So coming into Kenya, again, the picture is also almost the same. So it's, there's at least 37,000 deaths which are attributed, which are associated with antimicrobial resistance, and 8,000 attributed for the year of 2019. And I'm skipping this in the interest of time. E. coli and Klebsiella pneumonia are the 2 major pathogens which are most deadly in the sense for Kenya. And if we look at the AMR architecture here, AMR, it started with a good foundation in Kenya, with the National Action Plan being ratified in the first phase, in 2017. It was one of the earliest national action plans, as we had seen in the earlier slide. 2017 was the beginning, and which was well aligned with the Global Action Plan. Human, animal, and plant health sectors were active in the planning in the first phases, but environment and food safety and food production were missing in the sense that. And then you could see that in the surveillance, I think human and animal health, there were some surveillance infrastructure which have been developed and surveillance protocols which have been developed, but in the environmental sector, there have not been any surveillance efforts. And when it comes to the objective 3 of the National Action Plan, which aims at reducing incidence of infection, there were no guidelines and measures for AMR regulation in the environmental sector. Now, this is according to the self-evaluation of the JEE. And the multi-sectoral coordination committee at the national level have been established, which is the National Antimicrobial Stewardship Interagency Committee, which involves different agencies. Even the Ministry of Environment is part of that, but a very formal part. And The county level committees were also established for 14 of the 47 counties. Maybe, I think as we are talking, maybe a couple of more must have got the county level committees. But in all, I think we have seen, and with the environmental department is consequently conspicuously missing at all levels. So we can just look at this anecdote that one of the UNEP country program officer in Kenya, who's mentioning that, okay, we first need to collect data on antimicrobial resistance to make informed decisions. This will entail strengthening AMR environmental dimensions by addressing issues such as pollution. So this is as late as 2022. So this is beginning. I think the UNEP, once it entered, it started having a dialogue with the national environmental management agencies, authorities, and so on. So if we look at the brief review of literature, we see that a lot of resources are polluted with antimicrobial substances. There are several studies. I mean, I won't go through them, but if we look at that, it's almost present in everything. Sludge, dump sites, wastewater treatment plants, informal settlements. So the studies are focused on various areas, various locations, and various resources for antimicrobial contamination. And hospital wastewater, groundwater, even river water, and so on, and soils also. So, there are different sources which are important, which indicate that there's food production as source, and industries, pharmaceutical contamination, and households in terms of, informal settlements, which dispose of antimicrobials, and also which do not have proper waste disposal and waste treatment mechanisms, sewage treatment mechanisms. And of course, hospitals, which have disposed of hospital healthcare waste, so to say. And then we approach the problem from a polycentric governance perspective. I think I'll try to spend a couple of minutes on this, why and so on, why it is, I don't know how many of you are familiar with this polycentric governance approach. So it began in the 1960s to understand how the provision of public goods and services is organized across sectors. And this becomes even more relevant when we're talking about multiple public goods and services which are interdependent, which depend on the same resources. So it's basically talking about, according to Vincent Ostrom and et al., says that when there are many centers of decision-making which are formally independent of each other, but which exhibit functional interdependencies, they have a certain sense of autonomy in terms of decision-making, but they enter into relationships with each other, which could be, based on the principles of cooperation, principles of coercion, command and control, or based on principles of competition, which could be competitive relationship. But as long as they have a recourse to centralized conflict resolution mechanisms, they are supposed to function as a system, as a polycentric system. So, of course, I mean, in literature, if you're familiar, I think there are enormous amount of polycentric, positive attributes which are credited to polycentric systems. Like polycentric systems are good, essentially good, and they solve the problems and so on. But I think we take a more positive analytical approach. We contend that, okay, all the systems are polycentric because everybody has an agency and they decide. Even the lower level governments, I think they kind of, in adapting the national level policies, they exhibit a certain sense of agency in adapting and implementing the legislations. So we explain the governance structures, their causes and performance in a value-free way. We don't attach any value to polycentric governance systems per se, but we say that, okay, everything is polycentric when we try to analyze what affects coordination, whether they are effective, and in achieving the desired results and so on. So, one thing which is worth mentioning is the institutional analysis and development, which is an analytical framework which has been most widely used, which has been developed by Elinor Ostrom and her colleagues in Bloomington, in Indiana University, and which kind of operationalizes the polycentricity approach. But in most of the applications of IAD, Institutional Analysis and Development Framework, has been on a localized self-governance for managing resources and so on. And so, however, a self-organized form of governance is nested in the broader polycentric governance system. It has to be supported by the things. So, which means that there are different forms of coordination which are possible under a polycentric system. Not public goods and services, the provision of them in a coherent manner cannot be achieved with one particular form of coordination mechanism. Sometimes you need a mix of cooperation, networks and markets and hierarchies, which are really important. So these are frameworks, and then I think in the interest of time, I think we are already crossed. I don't want to spend too much time in this, but maybe I think it's worth mentioning that action situations are the fundamental core unit of this IAD, Institutional Analysis and Development Framework. Action situations are defined as those spaces where two or more individuals which are called participants, who assume certain positions and who follow certain rules, and are faced with set of potential actions, and they interact with each other, which are bound by these rules and which produce certain outcomes. And these action situations are nested, across different levels, which again brings us to the levels of analysis. Now, at what level are you analyzing? For example, if there is an action situation where the waste treatment is done or waste disposal is done, the rules that they follow are an outcome of another action situation where actors sit together and interact with each other and develop rules, which then constrain, which then define the options that the actors in the operational choice level have. So I think that's briefly about that. And then we try to adapt this approach to the AMR, and looking at AMR from a polycentric lens using IAD, a network of action situation concept. So here we see different action situations at the operational choice level: food production, industries, households, and how they dispose waste and the treatment behavior. And then we have at the collective choice level treatment of solid and wastewater, and coordination mechanisms at the county level and so on. And at the national level, at even higher level, we have different sectors and sectoral decisions which are being made, and again, the coordination mechanisms at the national level. And all these are impacted by the contextual factors, which could be rooted in the biophysical attributes of whether the irreversibility of pollution and the costliness and effectiveness of the available treatment technologies and so on, and rules in use, and so on, which could be formal and informal. So just quickly jumping into the key findings, I think I'm a bit
30 minutes total.
Yeah. Okay. So I think this is what this slide shows is a list of formal legislations, which all have which all kind of influence the actions of different actors in different action situations. Now, we only talk about public health, animal health, and environmental health, and these are the key, only the key, most important policies and guidelines based on which actors act. And there are also others like Kenya Bureau of Standards, which are not even part of the, which belong to Ministry of Trade and which are not even considered, which determine, the standards for effluent norms for different, pharmaceutical industries, for that matter, no? And there are also, Water Resources Authority, which does not fall under the Ministry of Environment, which is not even party to the, which is not even part of the National Coordination Committee. So these are different actors. I think I only managed to mention these different actors. I think as a next step, I really have to characterize these different actors in terms of their capacities and their interests and their rationalities, how they act based on how they act, and not only the formal relations, but also the informal rules which determine their choices of action, whether to, and then the effectiveness of the formal institutional arrangements. So but I think it's, when we talk about the integrated strategies, it's also important to know that One Health strategic plan was also formulated in Kenya, basically for prevention and control of zoonotic diseases. So now there is a plan to bring AMR strategies also under the umbrella of One Health, so which is still happening, but right now they are separate entities. So they are overlapping actors, but there is no direct relation between the two arrangements, let's say. And now I think as we're talking, I think the second, the National Action Plan, although it says 2023 to 2027, it was still on the tables for signing off by particular ministries when the field research was being conducted. So the second National Action Plan has a better integration, of environment, at least on paper, and because also at the multilateral, at the global level, the UNEP is also part of the quadripartite now, and it is also engaging in a dialogue with the National Environmental Management Authority. So in terms of developing capacities and so on. Okay, so I'm not going into detail about all the different rules that formal regulations, but jump into direct, the most important or emerging pictures, you can say, The Water Resource Authority, which is the custodian of water resources, and which is an important medium through which if we are talking about AMR through environmental dimension, water is a critical resource. So the Water Resources Authority, which is the key custodian, let's say, of the water resources in Kenya, it lacks the mandate, and it does not have any standards or norms to monitor and control antimicrobials in water resources. There is a researcher sitting in the Water Resources Authority who is coming from a scientific community, and then who has his PhD in water resources. He did it out of his own interest, but the authority itself, as such, does not have a mandate. So that shows that the AMR is not integrated into the governance framework of environment. And likewise, the environmental resources are not integrated into the AMR governance architecture, which is still beginning to be integrated, but it is not fully integrated as of now. But even now, the WRA is not part of the AMR governance architecture, although it is the one which is actually testing water and actually regulating water in that sense. And of course, there is some informal coordination between NEMA, which is the National Environmental Management Authority, and Water Resources Authority. But these are in a very case-based instances. It is not institutionalized for tracking and for monitoring and controlling AMR per se. And yeah, there are formal regulations in place in general for combating pollution, but of course, as one would suspect, I think the enforcement capacities are really weak in terms of testing capacities and sanctions and imposing sanctions and so on. And yeah, when we look at the National Action Plan for AMR mitigation, the environment has been excluded in the first planning phase at all levels, even the multilateral level. I think during our interviews, it came to for that there has this multi-party trust fund, which is formed to different all the members of the quadripartite. But since UNEP became the member of this quadripartite very late, so it was absent in the first phase of the multi-party trust fund project, MPTF project, which Kenya also had a grant. So so there have been like antimicrobial stewardship policy and guidelines developed, but only for the human health sector. It's been very well implemented with a lot of accolades in the human health sector. Of course, there are some gaps still, but I think it is still more or less there for the human health sector. But there is no discussion about the antimicrobial stewardship in the environmental sector. So and also, the costing of the activities in the National Action Plan, not all the activities were costed, even though they were for human and animal health sectors. And in the National Action, the second phase, I think there has been improved emphasis on environmental AMR, yeah, with inclusion and monitoring of environment. I think there is probably, if you're familiar with this tri-cycle protocol, I think they are trying to develop one such thing also for Kenya, although it is not one of the pilot countries. So they're trying to develop an integrated protocol for I think the tri-cycle protocol of WHO was developed for E. coli to ESBL E. coli. It's AMR, antimicrobial resistant E. coli. So there's been an integrated protocol which has been developed at a global level, which has been there have been attempts to adapt and implement that in pilot countries. So Yeah, so the capacities of relevant agencies were not taken into consideration while drawing up the plans, the National Action Plan, and Water Resources Ministry is still not part of the NASIC, National Antimicrobial Stewardship Interagency Committee. So what the picture that is emerging is that there is a fragmented governance of not only AMR mitigation, where environmental dimension is just beginning to be recognized, but also water governance is fragmented across ministries, environment and water resources, and coordination mechanisms which are there at present. They are not so effective in integrating the key issues. This could be rooted in various reasons, asymmetric distribution of resources across sectors and across levels, and also, because of the inherent complexity of the problem and involving diverse policy issues. Next steps, as I mentioned, I still dare myself to present these results. It's an ongoing analysis and which I'm still looking at. And once the analysis is done, I think we have to really sit with partners to look and validate these results and basically co-author some of these results. And then also the idea is to finalize the results and submit into a peer-reviewed journal by the end of the year. And also we have another case study coming up, which is similar also in Cambodia, for which field research is planned in November and December this year. So we already are in touch with the stakeholders in Cambodia and also other multilateral stakeholders in Cambodia. So with that, thank you very much, and I'm sorry for taking a bit longer than usual.
Well, thank you, Srini. That was great. There's so many things that can be said, but one of the things that is very obvious is nothing more powerful than a case study to actually begin to illuminate the complexity of a particular problem or challenge, especially when you don't have complex institutional systems with monitoring and evaluation mechanisms built in. Case studies are really, really powerful tools for beginning to understand the complexity of a problem. So you've done a great case study. I mean, this is really, really good. I encourage people to ask questions, and if you just raise your hand, that'd be great. But before I do, I just want to acknowledge that there's two people here. Babatunde. Babatunde is, this is his first experience at the Dahdaleh Institute. Babatunde is an incoming PhD student and is a recipient of a Dahdaleh PhD scholarship. And he is officially now a Dahdaleh scholar. So welcome, and feel free, to engage. And then the other person that I'd like to acknowledge is Daria Rakin, who is a friend and colleague of mine, who is very interested in exploring different ideas and pathways for her career in the future. And so she's very interested in global health and how some of her particular interests might intersect. And you're very welcome. And if you have a question or any comments, you're very welcome to participate. And with that, I have a, go ahead yourself, Chloe, first with the questions.
Yeah, thank you for your talk. I had a
Nice and loud if you don't mind. Yeah.
One was about, you talked quite a lot about wastewater and effluent. I was wondering if you considered wildlife as a part of the environment, and if any policymakers or actors who talked about in Kenya mentioned that. And the other one was just about, in your interviews with the environmental sector, whether you got an impression of how they saw the issue of AMR. Did they see it as relevant to them? Were they kind of like, why are you talking to me about AMR? Just from our experience, sometimes the environmental sector doesn't see themselves in these issues. So I was just curious what like attitudes and kind of identity of that sector was in context, right?
Yeah, shall I take that? Please, thank you. No, regarding the first question, the wildlife, I'm afraid, I think of course, I mean, it's one of the important parts of, if we're looking at zoonosis and so on, probably also AMR, but I think it did not figure in the discussions. I think also in the literature, I did not find that so prominently. So I think that's the reason why I did not focus on that. I think also it never came up in the conversations, like when talking to stakeholders as an important factor for development of antimicrobial resistance. And secondly, the environmental sector, I mean, they are interested because there are some champions, like when there's been like a lone champion in the NEMA, the National Environmental Management Authority, who has been very proactive, trying to push this agenda from the environmental side, and similarly also Water Resources Authority. I think it's very individual based and not really institutional. So it has. But I think I still need to dig deeper. Like what were the reasons? Of course, we have discussed several times. I think we have exchanged several times and so on. But I think the real factors need to be analyzed, like why and what to. Of course, it boils down to all this asymmetric distribution of resources, also, a dominance of particular sectors, in the whole picture and so on. So it's considered, when you talk about AMR, it's considered the domain of human health, or maybe next followed by animal health. So environment is somehow not in picture.
Yeah. So go ahead. Did you raise your hand? I wouldn't say good. You're welcome.
I think
go ahead, Dr.
So thank you so much for that presentation. I was looking at one of the slides. You did talk about pollution, and I'm taking into account the work that we have done in the past in Kenya, specifically Kisumu, where we looked at water quality and also came up with E. coli. So, and based on what you are presenting, it appears much has not changed with regards to the pollution. And I'm wondering, your conversations with stakeholders, what would it take for there to be a change? Or what would it take for government to make sure that this water bodies are secured? What would it take for us to address some of these issues you've talked about with regards to specifically the Kenyan population?
Yeah, thank you very much for that question. And I think we can also generalize it to other parts also, like it's not specific to Kenya, but I think in Kenya, what needs to change is that, two levels. One is institutions in the sense that it needs to be in the mandate of the environmental, regulations, for example, there's water quality standards. They do not, the parameters, I think they test up to, 30, 31 parameters, COD, BOD, and also even E. coli and so on. But they do, the antimicrobial resistant genes or antimicrobial resistant pathogens is not in the agenda. So it needs to figure, it needs to be integrated into the mandate of the environmental protection agencies, one. And then second is, I think there could be synergies, like I think they right now, the NEMA and Water Resources Authorities, they fall under different ministries. I think these coordination needs to be institutionalized in order to be strengthened, that's one. And also, on the other way around, this thing need to be integrated also into the AMR governance architecture. For example, there's this new initiative of this, as I mentioned, this tricycle protocol. I think that could be let's say a good, that could be used as a leverage to strengthen this coordination across different agencies, to bring different agencies to table which are now absent. So and then the last but not least, I think it's good to have a pilot case and so on and develop a protocol, but it's also what also matters is the capacities for testing and so on. So there needs to be costing of these activities, okay, it's good to have a plan, and also it needs to be matched with resources, with the national budget lines. So that's something which is also crucial. And I think I would leave it at that. Yeah.
Just a follow-up. Thank you for bringing that up. I wonder whether IDOS is looking into building capacity in that regard.
No, I don't think we have. I think we IDOS we are more like a policy advice organization, and then we do conduct research and advise not only the German government but also the partner governments in Kenya. So I'm afraid our job ends there. But also I think it's for the agencies. For example, we communicate also very broadly and bring our findings into networks like the NPTF or the quadripartite, like maybe that's something for them to take up, and then to strengthen the institutional capacities in different countries they operate, to capacitate them to conduct these activities. So also the German government, for example, it's not often the case, but in Cambodia there is the large investment project, which is okay, what is large? So there's an investment project which is being planned for One Health, to strengthen the One Health capacities, to One Health approach in these countries, and AMR figures very prominently in this plan, and also GIZ, another implementing agency of the German system, is also helping in drawing up the second multi-sectoral action plan. So I think so we are constantly in touch with them. So I think that's one way of getting the voices heard, and then trying to influence decision making and so on.
So we have a number of questions. So I just ask the questioners to be, and then the answer to be. So over to you, Adele.
Thank you, Srini. This is really interesting work. My question is on Eleanor Ostrom's framework, IAD framework, and for the case study to understand the action situations. And that's a really well-established, well-known framework. And a good framework like that one, it's going to be my question, can be very helpful, but it can also be too specific, for example, can be too rigid. It may not, if a framework is too rigid, it may not be able to capture the specificities of a particular concept. If it's too broad, it'll be too broad. I want to know, in your research design and experience, how was it using that framework? Did you encounter any challenges? If so, I'm curious to know, and in what way it worked well for you in applying it to this particular case study.
Yeah, thank you very much, Idil. I think that's a very important question. IAD framework is a heuristic. As Ostrom always like to call it, it is at a meta-theoretical level. It operationalizes the concept of polycentricity in a way by showing, okay, there are different actors in different action situations, and each action situation generates a different governance function. Whether it's provision of goods and services, or provision of rules, or and these kinds of things. Different governance functions. So it helps you organize the analysis. It's and ask questions, ask relevant questions. It puts all the variables there. Which are, let's say, which could be relevant for different theoretical from different theoretical standpoints.
Mm-hmm.
Now, people have used scholars have used the IAD framework, starting from for deductive research and inductive research, and coming from a very game theoretic point of view, looking at specific action situations, looking at strategies of different actors and what constraints and so on, and also at a very at a broader level, looking at coordination among actors and what using a case study based approach, like, and more explorative in the sense that when you don't know much about the case study, it's a niche area to study, like to really explore the situation by looking at the factors without starting with the hypothesis, but also we can end up with generating hypotheses.
Oh.
So this is, I think the framework itself does not constrain research that much. I think it's how you organize it, and it helps you ask questions, and you can select. Like you cannot answer all the boxes in the framework, but I think you can, based on your disciplinary inclination, your analytical approaches and tools that you have, then you can choose different variables and different hypothesis relation, hypothesis different relationships. Yeah, sorry.
That's great. That helps. Thank you.
It's great. Just like to also welcome Dr. Srinivasa, who is here he's a community fellow here at the Dahdaleh Institute, and Sami's online. So just seeing you. Hi, Sami. You're welcome.
Thank you so much. It was, first of all, I want to greet to all of the colleagues who are online or sitting behind the table. Thank you so much to giving me the opportunity to be part of this presentation. My question was about the number of dates, which was around, if I'm not wrong, 77,000. I just want to know about the main attributor factor to this antimicrobial resistance, and also about the feasibility of the recommended strategy to the government or maybe to the country with the low income. I have concern about if we were making the recommendation to the policy makers, it may multi-sectorial collaboration may cost too much. Is there any specific policy to convince, and also about the strategic costing, how much it costs? I think that if we could find the main attributor factor to the number of death which was occurred on the country level, if we could target specifically on that areas, it would be great. I don't know if I'm not wrong, it is already covered in the part of this strategy recommendation or not. Thank you so much. I want to hear from my friends.
Go ahead. Yeah. Thank you very much, Dr. Sami. And with regards to the estimates of deaths for AMR, I think I must say that I think there are associated deaths and attributed deaths. I think that refers to the confidence interval, and then I must admit that I do not remember. At least I remember to have read that, but I think it's it was a very big study conducted in recently. It was published. It was in 2022, which predicted at a global level and also at the country level. I think based on the reporting, to the traces on the number of deaths. But exactly what were the factors that were attributed to is something which is not. I mean, I'm not familiar with. I must admit that. But I think they distinguish between attributed deaths, which are more attributed directly to the AMR, I think, which was far lesser. In the case of Kenya, it was, I don't know, 7,000 or 8,000, and associated deaths. I think there could be other I suspect there could be other comorbid attributes which were there.
Yeah, just to give an example. So you said Klebsiella pneumonia.
Yes,
is one of the major issues in antimicrobial resistance for Klebsiella and pneumonia is one of the major issues. So a person can die of pneumonia, of Klebsiella pneumonia, and that would be an attributed death, right? So it's direct to that. A person can have congestive heart failure, and because they have heart failure, they will get a pneumonia, right? So the pneumonia is a consequence of heart failure. And it can be the same cause, Klebsiella, for which there's antimicrobial resistance, but they die of congestive heart failure. So that is an associated death, right? So that's the difference. So it's 1.27, I believe, is attributable, 1.27 million attributable globally, and then 4.92, I think it is, are associated deaths. Yes. So that's the distinction.
Yeah, thank you for clarifying, James. And with regards to the proposed strategies, Yeah, you're right. I think the capacities are really, I think that's also one of the point that I mentioned in the conclusions, that I think the capacities of the within the countries need to be considered while drawing up the plans. And I think that gives a much better picture of what can be done. Okay, it's one thing to have a plan, but it's another thing at the end of 5 years if you have not even achieved 20% of that without costing. First step is costing. I think right now, I think when I was there, I think costing exercises were going on in Kenya. I think I was told that, okay, they're involved in this costing exercises. And the second step is attaching the budget lines to that, And I think there are several multilateral and bilateral agencies which are also involved in building capacities. But whether they will be sufficient to achieve what has been stated in the plan is something which can also be questioned. I think that has to be discussed among the stakeholders, and I think a lot of prioritization happens, and exactly what factors underpin this prioritization is another thing which we can discuss. Yeah, so that's something. Yeah, that's a very good question, but I think at the moment I am unable to answer what activities have been prioritized and how which activities have been costed in the second plan. But in the first national action plan, I think it's very clear that Kenyan national action plan, as in also in other national action plans, many of the activities have not been allocated resources. So as a result, what we have is that many of the activities not being fulfilled and the objectives not being achieved.
So I have one comment and one question, and then we'll have to close, unfortunately. The comment is that antimicrobial resistance is it's just by virtue of what you presented, it's a very complex problem. It's not a problem that for which there are simple, easy solutions. And I would say that there are prior experiences in dealing with environmental challenges that might bear on the approach to the complex problem of antimicrobial resistance. And I'm thinking of, for example, the approach to polychlorinated biphenyls. And in the 80s and 90s, there was a huge problem. This was the genesis of Rachel Carson's Silent Spring. Was the problem of polychlorinated biphenyls and their impact environmentally, but also on human beings. And environmentally, we were seeing, and I'm very happy that Chloe raised the question of wildlife, we were seeing mutations in primarily amphibians, but also in other higher level mammals. And major genetic modifications that were occurring and mutations that were occurring that were a major threat to species viability. That was a very complex problem, but that it communicated in a manner that led to practical, concrete solutions. The same is true with hydrofluorocarbons, which are used largely in refrigeration and in other areas. This has major impacts on the ozone layer. And again, a very complex problem, multiple players and partners and actors and so on. And that led to eventually a treaty on protection of the ozone layer and limitation of hydrofluorocarbons and use thereof. And that's recently, just a couple of years ago, I think it was 2018, 2019, there was another final major agreement internationally about limiting the use of hydrofluorocarbons, largely prompted by the rapid increase in the use of air conditioning because of climate change. So there are complex problems and they're not unsolvable. And to that end, I would suggest that one thing that might be worth sort of thinking about is that when you talked about polycentric governance, I thought, first of all, your presentation was great. And you really captured the essence of the complexity of polycentric governance, as well as obviously of AMR. But one of the things that you said about polycentric governance is that it's fragmented, right? And that there aren't clear loci of responsibility. And there's also not clear loci of inclusion of relevant stakeholders. And that's really, really important. And I wonder if a slightly different approach to polycentric governance that might be interesting would be an approach that would take an intervention approach as opposed to a monitoring approach. And we know that, for example, with antimicrobial resistance, if we reduce the use and increase the appropriate use of antibiotics, that will have a big impact, first of all, on the preservation of the viability of antibiotics. The second is focusing on release of effluent and waste, and focus on effluent and waste, and then also on extractive technologies. So are there technologies that can be used to extract antibiotics, right, from effluent or from waste, that could be not developed, but implemented? And so if the approach is not so much about mapping the range of actors, but mapping actors according to interventions, then at those points of intervention, you can limit you can limit the emergence of AMR. And then the final comment is, you talked about the PNEC, so the point of no effect concentration of an antimicrobial. And that is the metric, right, that people use in the environment and elsewhere. And I think the question is, the point of no effect of concentration on what and on who, right? And that is a really important question, because there will be different effects environmentally on wildlife. There'll be different effects in the agricultural sector, different effects in the human domain, and so on. So those are just some thoughts, some comments. I'll just give you a minute or to react, and then we're gonna close.
First of all, thank you very much, James. I think these are really important points, and which I would consider, and then in my further analysis, and also to the examples, the two examples that you provided, and that we can learn from the experience of the previous environmental and how they've been dealt with, yeah, I think one is there's just correct me if I'm wrong. I think with the HFCs, I think it was more like a global agreement, and then it was very much top down, and then regulations were in place, and then at source, at source they were like banned or like regulated. Products which produce HFCs were regulated or so on. So there was an international agreement, and then I think right now, I don't know if it also relates to consumption and production of the, let's say, public bads, HFCs or antimicrobial resistant pathogens. But I think it's I don't know. I think each matter is dealt with a certain different sense of urgency. I think it's also, there are a lot of other factors. I think maybe it's good to explore what has been there or how this has been achieved. I think this is one of the huge success, HFCs. I think it's so I think we can learn a lot even for climate change, for example, in that sense. So I think that's something which I will also look into. And with regards to the the second point on an alternative to polycentric governance approach, and looking at the intervention and then mapping interventions and so on. I do not necessarily consider that as something beyond the scope of polycentric frame, in the broader sense. Now, when we don't just necessarily talk about actors, but also their actions, like the interactions and how they interact not only among each other, but also with their biophysical interactions, what kind of the technologies that they use to produce or treat waste in that sense, and so on. So this is all only to say that, okay, we try to understand the factors, all the contextual factors, which include institutional, biophysical, and also even political economic factors, which determine the choices of technologies and so on. So this is, and then I think that this understanding is also crucial to determine what solution is feasible in a given context. Not maybe for a country like Canada or Germany or the US, I think which has like not unlimited, at least a sufficient amount of resources at disposal. I think we can we can still talk about technologies to retract, like this, extract this harmful chemicals and so on. As you mentioned, there's also, like there's a precautionary approach is something which is this probably makes more sense, like when we talk about this nature-related transactions which are irreversible. I think the kind of biophysical transactions determine what kind of instrument is more suitable. Whether it's irreversible, whether it's too costly to treat, or I think that's also both the biophysical and socioeconomic and institutional attributes of these different available technical options are something which need to be considered in depth. I think it's, as I mentioned, I think it's not the problem with the approach, but I think you have to draw analytical boundaries at some point.
Absolutely.
You have to focus something.
Well, thank you.
Thank you very much. Yeah.
So I'd just like to thank you, Srini, for just a really great and stimulating, really stimulating presentation. And I would also like to thank Adil Boren, who runs the Synergies of Planetary Health Research Initiative here at the Institute. I'd like to thank Adil for bringing us such a great visiting scholar. And Srini, you're welcome here. In perpetuity. That might be
Wow.
that might be a slight overstatement, but you're very welcome, and we look forward to working with you and interacting with you over the coming weeks and months. So welcome and thank you.
Thank you very
With
much.
that, we'll close the seminar. Thank you very much. Yeah, I will just say one last thing. Sorry. Our next seminar is on June 19. It's at 1 o'clock. And it will be hosted by Kate Tillage, who's a professor here as Canada Research Chair in Faculty of Education. And she runs a project that we collaborate on with her called Rooted and Rising, Co-Developing Experiential Education for Youth Climate Change Leadership and Planetary Health. And she and her team will be presenting on that on June 19 at 1 o'clock. And of course, everyone is very welcome. And with that, I will close the seminar.